I had to choose my specialty in a very fortunate year in 2015, and it was the time where five landmark randomized control trial proved the efficacy of endovascular thrombectomy in patients with large vessel occlusion strokes. I was fortunate enough to be having a rotation in neurology at that time, and I myself witnessed the miraculous effect of the procedure, and that was fascinated me. That's why I made up my mind to pursue my pathway as an interventional neurologist. Right. As for the difference or the differences between neurology and other medical specialties, I think in terms of the spectrum of neurology, it's actually very wide. So you got hyperacute patients like ischemic stroke patients, hemorrhagic stroke patients, and you got very chronic patients like those who suffer from neurodegenerative disease. And in terms of curability, actually, there are some conditions that are highly treatable now, for instance, ischemic stroke. And there are a lot of neurological disease that are yet to be curable. On the one hand, we are healers, we provide treatment that can potentially reverse the underlying disease of patients, like patients with ischemic stroke. We provide a reperfusion therapy. Patients with autoimmune encephalitis, we provide immunotherapy. However, for patients with some neurological, neurodegenerative conditions, sometimes we take up the role as counselors and also to be very good listeners in the patient's disease journey. So I think the spectrum is the most notable difference between neurology and other specialties. Well, in Hong Kong, neurology is a specialty under internal medicine. You have concurrent training with internal medicine. Both neurology and also advanced internal medicine you have to, take care of. And frequently you have to have overnight calls during your training. And so that means that you have to take care of acute neurology patients and at the same time acute medical patients. So I remember during my higher training, I was the stroke call that night, and at the same time I was the ward call in the Department of Medicine. I remember I was having 3 acute stroke patients that I have to take care of in the emergency department. I had to assess them, interpret the images, and to make a decision on reperfusion therapy. And at the same time, I got called for 2 CPRs, so arrest calls in the medical ward. So I was actually dealing with like 5 patients, 3 acute stroke patients and 2 arrest calls at the same time. So that was a very hard period. And I think what guided me through was actually the friendship between, with other colleagues. Fortunate enough, I got to call 2 colleagues to help with the arrest calls. And I was able to take care of the acute stroke patients that time. Right. So that's the major challenge. And I think it's quite generic because especially you have for specialties that have acute patients like cardiology, neurology, and also gastroenterology for GI bleeds. You get to see acute patients, specialty patients, together with internal medicine patients at the same time, and that could be quite challenging. Well, I would not say I'm an excellent clinician, but I attempt to be a better one than I was yesterday. And I think it's rather generic, again, being passionate with your work and your patients, and also have a strong sense of responsibility, having a critical mind. And I think the most important quality or aspect is you're able to share the joy and also the excitement when your patients improve. Yeah, so I think that's a very critical quality. Well, I think being a neurologist, I mean, for neurology, there are actually a lot of subspecialties. So it suits a lot of potential candidates, of course. And if you do enjoy dealing with acute cases, of course, you can pursue a pathway of a stroke neurologist. And if you are a very good listener and a very good counselor, then dealing with chronic neurological diseases is actually one of the very feasible career pathways. So I think the most important thing, again, it all goes back to passion. And it's sometimes too early for young medical students or medical officers to make up their mind whether they want to be neurologists or not. So it's very good to experience it. Okay, so for students who are passionate in neurology or neuroscience, I strongly recommend they attach to a neurology unit or neuroscience laboratory to see if they are really excited or interested in the fields. Yeah, so experience is very important. Well, so for a normal day, I got research clinics and also service clinics, and I also got intervention sessions. So I perform carotid stenting and sometimes intracranial stenting in collaboration with interventional neurology, neurointerventional radiology. And however, throughout the day, if I'm the stroke call, I'll need to attend the patient in the emergency department right away. So for instance, when I'm seeing the clinic and when I receive a call from the stroke nurse or emergency department saying that there is a potential candidate for reperfusion therapy, I have to drop my work on hand and attend the patient immediately to make treatment decisions. So that could be a bit hectic, yeah, but I do enjoy it, right? However, when I'm the overnight stroke call, then I'll have to stand by whole night and assess the patient either through telemedicine or in person whenever there is an acute stroke patient. Well, for inpatients, stroke is of course the major or the majority of neurology patients who require inpatient management. However, there are actually a lot of other very common neurological conditions. For instance, epilepsy, status epilepticus, and we also frequently deal with patients with CNS infections, autoimmune encephalitis, neuroinflammatory conditions. So these are actually also common neurological conditions that we have to deal with as inpatients. Well, definitely time is a constraint. And so being timely is not one person's job. You have to leverage the whole team to help one patient. So for the chain of survival of an acute stroke patient, it begins with the emergency medical service. So the emergency medical service or the ambulance men are actually critical in pushing the time limits in acute stroke triage. And after the patient's arrival, the nurses and also the doctors at the emergency department play critical roles in securing the resuscitation room and also the CT suite for assessment. And at the same time, when we've received the notification from the emergency departments, the stroke nurse and also the stroke neurologist will go through the medical records of the patient to see if the patient is suitable for reperfusion therapy. And afterwards, they will go to assess the patient, either by telemedicine or in person again. So if the patient needs advanced imaging, like a CT angiogram or CT perfusion, then the diagnostic neuroradiologist also plays a critical role. And they have to read the reports, the images right away, and provide a verbal report, because we have to decide on the spot whether the patient needs endovascular treatment. So in the endovascular treatment territory, in the angio suite, the angio nurse, the radiographers, and also the interventional radiologists, they play a very important role in the treatment, in the timely treatment of a patient with large vessel occlusion. So the challenge is being timely, and it really depends on the passion that the whole team shares. So I'm fortunate enough to be in the Prince of Wales Hospital, where everyone in the team is passionate. I think the challenge in stroke medicine currently in Hong Kong is to have a more widespread delivery of endovascular thrombectomy. So the evidence is there, and there's no doubt about the evidence, and the evidence is also evolving. So now the treatment window is expanding, and also the treatment indications are also expanding. The hurdle to translate evidence-based medicine into clinical service depends on a lot of factors. So resource, manpower, expertise, and also the healthcare policy decisions. So I think the hurdle or the challenge in stroke treatment in Hong Kong currently are actually these aspects that I've just mentioned. And regarding new treatment, of course, as I've mentioned, advanced imaging is getting more and more popular, and advanced imaging also enables personalized medicine in acute stroke management. So on top of that, our team, the CUHK neurology team, is also working hard in profiling patients with favorable perfusion that do not fit current thrombectomy indications. And also we are exploring neuroprotection before or after endovascular thrombectomy to minimize the treatment complications and also enhance the recovery of patients with acute stroke. Well, one critical aspect is the aging population. So Hong Kong now has the longest life expectancy. And despite the improved primary prevention in terms of like hypertension, diabetes, hyperlipidemia, and of course atrial fibrillation, the steep climb of the elderly population actually overcomes the improvement in the primary prevention, and that's why the stroke burden in Hong Kong has been surging throughout the years. This is one of the major reasons, and in the mainland China, of course, genetics and also the suboptimal primary prevention may play a role, and that renders stroke being the leading cause of death in the mainland China. And the burden is so huge that we really need to rethink about our primary prevention strategies as well as the resource allocation in acute stroke medicine. Right, so to understand that it's a major health problem worldwide, maybe let me elaborate on the burden of stroke in China and in Hong Kong. So, every year there are around 2.9 million new stroke cases in the mainland China, and that roughly equals the whole of the working population in Hong Kong. And so as you can imagine, the burden is actually huge. And if you are into the World Health or World Stroke Organization statistics, actually 1 in 6 people worldwide will suffer a stroke in their lifetime. So actually stroke is a very common condition that you will need to deal with at some time point of your life. So, being a doctor or being a son or daughter, you will need to take care of stroke patients eventually because stroke is very close to us. Therefore, equipping yourself with the knowledge on the presentation of stroke as well as the potential management of stroke will be very important. And actually, I have numerous incidents of inpatient strokes discovered not by doctors, but by nurses, physiotherapists, occupational therapists, and they are actually the key or the index point of contact for patients who suffered from inpatient stroke. So, for medical students or doctors, apart from your relatives having a possibility of being a stroke patient, in the inpatient setting, you can never do away with stroke because it's very common first, and also regardless of specialty, you got older patients who, for example, need anticoagulations, and their medications may be interrupted because of their surgical needs. So with the temporary interruption of these medications, they're very prone to stroke. And that's why it's very important to recognize these patients. And I would say the key to acute stroke treatment is the recognition. Right. So during your ward round, remember to talk to the patient, and and also to examine the patient. And if they have symptoms and signs suggestive of stroke, do remember to contact the stroke team. Yeah. And of course, essential information like the last known well to discovery time is critical in the chain of survival of stroke patients. So these key information will greatly facilitate the downstream management of stroke patients.